10 common diabetes signs in women. Ladies, what if I told you that the persistent itch you've been feeling, or that unexpected weight change, might be hinting at something more? What if these seemingly ordinary symptoms are trying to tell you about a silent disruptor lurking within? Welcome back to Healthy Habitat, where we explore health inside and out. Today, we're diving deep into the world of diabetes, focusing specifically on the ladies. Now, before we kick things off, I've got a special nugget for you. Sign number 9 is especially surprising, so make sure you stick around to catch that one. Let's decipher the top 10 common diabetes signs in women. Sign 1, frequent urination. One of the body's main responses to high blood sugar is frequent urination. This is due to the fact that the kidneys, which filter our blood, become overwhelmed with the amount of glucose. When the kidneys can't keep up, this excess sugar is expelled from the body through urine. But sugar isn't the only thing being removed. Along with glucose, the body expels a significant amount of water, which is why the urge to urinate increases. Frequent urination is not just an inconvenience. Over time, it can strain the kidneys, possibly leading to chronic kidney disease. This symptom is particularly noticeable at night, leading to disrupted sleep cycles, which can further exacerbate feelings of fatigue and lethargy during the day. Paying attention to changes in your restroom habits can be an early indicator of potential issues with blood sugar regulation. Sign 2, unexplained weight changes. Weight fluctuations, when you aren't intentionally trying to lose or gain weight, can be an alarming sign. When the body cannot use glucose efficiently because of insulin resistance or lack of insulin, it starts breaking down muscle and fat for energy. This can lead to unintended weight loss. On the flip side, insulin resistance can also make you feel constantly hungry. Insulin plays a pivotal role in signaling to your brain that you've eaten enough. When this signal doesn't work efficiently, you might find yourself overeating, leading to weight gain. This cycle of hunger, despite high blood sugar levels, is paradoxically one of the distressing aspects of diabetes. Sign 3, excessive thirst. Just can't quench that thirst? Polydipsia, or excessive thirst, is another symptom that's intricately linked to the body's response to high blood sugar levels. As mentioned before, the body expels excess sugar through urine, which means more fluids are expelled from the body than usual. To compensate for this loss, the body feels a constant need to drink water, hence the persistent feeling of thirst. This unending cycle of thirst and frequent urination can lead to dehydration if one is not consuming enough water. Dehydration, in turn, can cause a slew of other problems, including further concentration of blood sugar and strain on the kidneys. Sign 4, fatigue. Fatigue can be one of the most debilitating symptoms of diabetes. But why does high blood sugar cause fatigue? Glucose is the body's primary source of energy. When there's an inefficiency in transporting glucose into cells, there's a lack of fuel for these cells to function optimally. It's like having a full tank of gas but a broken fuel pump. The energy or glucose is there, but it's not being delivered where it's needed. This can leave an individual feeling constantly tired, unmotivated, and lethargic, affecting day-to-day activities and overall quality of life. Sign 5, blurred vision. Visual disturbances, particularly blurred vision, can be an early sign of high blood sugar levels. The reason for this lies in the body's attempt to deal with excess glucose. The fluid in the body, including from the eyes, is drawn out to help eliminate this glucose through urine. When the eyes lose fluid, the lenses can become temporarily misshapen, leading to refraction issues and blurred vision. This isn't just a short-term problem. Prolonged high blood sugar can lead to more serious eye conditions like diabetic retinopathy, where the blood vessels in the retina become damaged, potentially leading to blindness. Regular eye checkups and monitoring blood sugar levels are crucial in preventing long-term damage and ensuring clear, healthy vision. Sign 6, persistent itching and infections. Persistent itching, particularly in sensitive areas like the genitals, can be a distressing symptom. Elevated blood sugar levels lead to an environment that becomes a breeding ground for yeast and bacteria. High glucose levels in the blood can also increase glucose content in the mucous membranes, especially in the vaginal area. This excessive sugar can fuel the growth of yeast, leading to recurrent infections characterized by itching, burning, and thick white discharge. In addition, individuals with high blood sugar often experience slower immune responses. This compromised immune system makes it harder for the body to fight off infections, leading to a longer recovery period and higher susceptibility to various infections, from skin conditions to urinary tract infections. Hey there, just a quick note before we move on to sign number 7. I've put together a list of bestseller recommended supplements like vitamins, fish oil, and multivitamins. You can find the Amazon links right in the description box. But first, let's uncover the remaining signs. Sign 7. Slow healing of wounds. Slow wound healing can be a subtle yet telling sign of diabetes. Elevated blood sugar levels interfere with the body's natural ability to heal. The reasons are multifaceted. Firstly, high blood sugar levels can cause narrowing and hardening of blood vessels, reducing the blood flow to various areas of the body. Reduced blood flow means essential nutrients and oxygen required for healing don't reach the wound site efficiently. Furthermore, high glucose levels can lead to persistent inflammation, impeding the healing process. Also, as mentioned earlier, a compromised immune system makes it difficult to ward off potential infections at the wound site, which can further delay recovery. Sign 8. Darkened skin patches. Acanthosis nigricans is the medical term for the dark patches one might observe on their skin, commonly found around the neck, armpits, or groin. These patches aren't just a cosmetic concern. They are indicative of insulin resistance. Insulin resistance often leads to excessive production of insulin in the body. High levels of insulin can stimulate skin cells to reproduce at a faster rate, and it can also trigger an increase in melanin production, leading to these dark, velvety patches. Regular skin examination and monitoring for any changes combined with blood tests can help in early detection and management of underlying insulin resistance or diabetes. Sign 9. Tingling or numbness. Remember I teased about this earlier? Here it is. Often described as pins and needles, the sensation of tingling, numbness, or burning, especially in extremities like feet and hands, is a symptom of neuropathy. Diabetic neuropathy is nerve damage resulting from prolonged high blood sugar levels. Over time, excess sugar can injure the walls of the tiny blood vessels, capillaries, that nourish nerves, especially in the extremities. This nerve damage can lead to several issues. At first, it might just be occasional tingling. However, if left untreated, it can lead to sharp pain, complete numbness, and even loss of muscle control. It's essential to monitor and report these sensations early to prevent irreversible nerve damage. Sign 10. Polycystic ovary syndrome, PCOS. Polycystic ovary syndrome, PCOS, is a hormonal disorder common among women of reproductive age. While it's primarily known for causing irregular periods or even infertility, its ties to insulin resistance are substantial. Women with PCOS often produce more insulin than usual owing to their cells not using insulin effectively. This excess insulin production in turn can lead to higher than normal androgen levels, which can cause ovulation problems. While PCOS is not a direct sign of diabetes, the insulin resistance common in PCOS patients increases the risk of developing type 2 diabetes. Monitoring for symptoms of PCOS combined with regular blood sugar checks can help in the early detection and management of both conditions. So there you have it, the top 10 signs to watch out for. Ladies, understanding our bodies is the first step to ensuring we lead healthy, fulfilling lives. While the signs we discussed today may seem concerning, awareness is our strongest weapon against ailments like diabetes. If you or someone you know is experiencing any of these symptoms, please seek medical advice early on. Together, by sharing knowledge and prioritizing our health, we can create a healthier habitat for all. Don't forget to check out those supplement recommendations in the description below to support your journey to wellness. Thank you for spending your valuable time with us today. If you found this information helpful, please consider liking, sharing, and subscribing to Healthy Habitat for more health insights. Stay informed, stay strong, and see you in the next video.